and welcome to another episode on Healthcare Hub GA 233. On today's episode, we are going to discuss about something very interesting among women. So a lot of women have a fishy vagina smell and they obviously don't know what's causing it. So today we are going to discuss about it. So what makes the vagina smells fishy? So oftentimes people have unpleasant odor coming from their vagina as a result of poor personal hygiene, infection, imbalance in the acid-base level in your vagina. However, the commonest cause of a fishy vagina smell is bacterial vaginosis. So every healthy vagina has bacteria in the vagina. However, when there's an imbalance in their growth, then you develop this bacterial vaginosis. So obviously, bacterial vaginosis is just an overgrowth of bacteria in your vagina. So we have a normal or good bacteria in our vagina called the lactobacilli, which protect the vagina from infection. And then we have the bad, in quotes, bacteria in the vagina called the anaerobes. They are the ones that predispose us to infection. So when these anaerobes overgrow the lactobacilli, then you develop the bacterial vaginosis. So who can get bacterial vaginosis? Any female with vagina can develop bacterial vaginosis. However, people who are sexually active and people who have a lot of or multiple sexual partners, maybe you have Kwesi Kwame, Kwejo, that you have sexual intercourse with, you stand at a higher risk of developing this bacterial vaginosis. Also, women who are pregnant stand at a higher risk of getting bacterial vaginosis due to the hormonal imbalances that occur when you are pregnant. And those who douche their vagina a lot. So douching the vagina is when you flush your vagina with fragrances and perfumes, water, etc. You stand at a higher risk of developing bacterial vaginosis. Douching disturbs the normal flora of your vagina. So definitely, if you wash or you flush your vagina a lot with fragrances and water and hard soaps, you stand at a higher risk of getting bacterial vaginosis. And people who like raw sex, some people don't like to use protection best to their knowledge. However, so you stand at a higher risk of getting bacterial vaginosis if you have unprotected sex. How will one know that she has bacterial vaginosis? About 84% of women with bacterial vaginosis do not know they have the condition. However, when you see an off-white gray discharge coming from your vagina when you wash it or maybe when you pee, that means you have the infection. And then when you smell a fishy smell from your vagina, it's usually very offensive after having sex with your partner. You smell, that's the actual cardinal sign of bacterial vaginosis. You smell very fishy when you have sex with your partner. And also you feel some burning sensation and irritation after peeing. That's when you urinate. That means you have the bacterial vaginosis. So is bacterial vaginosis contagious? No. It is not sexually transmitted infection. However, studies have shown that if you have multiple sexual partners or you are sexually active, you stand at a higher risk of getting bacterial vaginosis. That means you can get it when someone has the bacteria and then you sleep with the person and then he introduces the bacteria into your vagina. However, it's not contagious. You cannot get it from swimming pools. You cannot get it from toilet seats. The only mode of getting it is what I mentioned previously. And how will you know that you have it? You need to see your healthcare provider for him or her to perform some pelvic examination on you. You have a chaperone in your room, and then your doctor will take a swab from your vagina, and then you will be taken to the lab for investigation. That is the only way you can know that you have the bacterial vaginosis. Also, let's not confuse bacterial vaginosis with yeast infection. Yeast infection is caused by a fungus, that's the candida, popularly known as candidiasis. Yeast infection is a fungal infection. Bacterial vaginosis is an overgrowth of the bad, in quotes, bacteria that I stated earlier. And with yeast infection, the discharge is cheesy in color. It is not off gray. It is not grayish. It is cheesy in color. And also with yeast infection, you feel pains when you are having sex. So the ladies or women that feel pain when they are having sex, they have yeast infection, not bacterial vaginosis. And you have severe burning sensation in yeast infection when you pee. With bacterial vaginosis, the burning sensation is a bit mild, but with yeast infection, when you pee, you really feel the pain from your vagina. So what are the preventive measures that someone can take to lower the risks of getting bacterial vaginosis? Avoid douching your vagina. Don't use scented soap. Don't use fragrances. Please, you just destroy the normal flora of your vagina. And also those who use sex toys, try as much as possible to use protection. The latest condom, you can cover your sex toy with condom before you use it. And also when you are cleaning your butts, sorry to say, after visiting the toilet, try cleaning from front to back. Don't use anything that touches the anus or the inner region to your vagina. There's a lot of bacteria in the inner region. So if you clean and then you clean, the tissue touches your vagina, you've introduced a whole lot of bacteria to your vagina and you stand at a higher risk of getting bacterial vaginosis. And also those who are ladies who use nylon panties a lot, you stand at a higher risk of getting bacterial vaginosis. So let's try as much as possible to buy cotton panties. You know, the nylon traps a lot of heat in our vagina and then it's not able to rake away the heat that traps there. But with cotton panties, it rakes all the heat from your vagina, keeping your vagina. We are not saying the vagina should be dried. Normal discharge is there, yes, we know. However, when you wear nylon panties, you trap so much heat and the vagina become moist. And this is where the bacteria grow well, in moist areas. So let's try as much as possible to get cotton panties or replace our nylon panties with cotton panties. What are some of the complications of bacterial vaginosis? So bacterial vaginosis seems to be a mild infection. However, it can make you have premature birth or you have low birth weight when you have this infection. So our pregnant women, don't think that because you are pregnant, you can't be treated for this infection. When you get to the hospital, your doctor or your healthcare provider will prescribe a safe medication or antibiotics for you, and then you'll be treated. Also, some ladies who have bacterial vaginosis and do not visit the clinics, please, you stand at a higher risk of getting pelvic inflammatory diseases. And then in future, you have difficulty of getting pregnant. So try as much as possible to visit the clinics or the hospitals for treatment. You cannot get treatments when you walk into the pharmacy like yeast infection. When you walk into the pharmacy, you get over-the-counter antifungals and use. No. With bacterial vaginosis, don't think it will go away. Even if it goes, it can come back. So try and see a healthcare provider and then let the doctor or your healthcare provider prescribe some antibiotics for you. Can men get bacterial vaginosis? No. Unfortunately or fortunately, men cannot get bacterial vaginosis. However, if a man sleeps with a woman with bacterial vaginosis, he can carry the bacteria and introduce it to you that you are safe if you don't use protection. So our dear men with multiple partners, if you cannot abstain, try as much as possible to use protection when you are having sex with your partner. Thank you and see you on the next episode. Bye. Thank you for watching. Please like, share and comment, and please don't forget to subscribe on our YouTube channel at Healthcare Happy 233. Bye.